Most people hear shockwave therapy and immediately think about getting electrocuted. They picture something painful, invasive, and maybe even dangerous. But here's what actually happens. Patients lie comfortably on my treatment table while I move a device that looks like an ultrasound wand over their foot. They feel a gentle tapping sensation, like someone rhythmically tapping their finger on their skin. That's it. No electricity, no pain, no needles. And yet, this gentle tapping can restart healing in tissues that have been stuck in chronic pain for months or even years. One patient told me, it's like my body remembered how to heal again. My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas, where I've been helping patients overcome chronic foot and ankle pain for over 25 years. Before I continue, please take a moment to like this video, hit the subscribe button, and share with anyone who's been told they have to live with chronic pain. I also want to offer you my complete audio course on regenerative medicine absolutely free at www.regmedcourse.com. This comprehensive course reveals everything you need to know about these breakthrough treatments. Let me clear up the biggest misconception about shockwave therapy right away. Despite its intimidating name, this treatment has nothing to do with electricity. You're not getting shocked. Instead, shockwave therapy uses acoustic pressure waves, focused sound energy, to stimulate healing in damaged tissues. Think of it like the ripples you see when you drop a stone into a calm pond, except those waves travel through your tissue instead of the water. The device looks similar to an ultrasound wand. I place it against your skin over the area of pain, and it delivers the pressure waves directly to the damaged tissues. The waves penetrate deep into the tissue, much deeper than any cream or medication could reach. But here's where it gets really interesting. These acoustic waves create what we call controlled microtrauma in the tissue. Now, I know that sounds counterintuitive. Why would we want to create more trauma to tissue that's already damaged? Here's what's really happening. When tissue is chronically injured, it often gets stuck in what we call a failed healing response. Your body started trying to heal the injury, but for various reasons, poor blood supply, scar tissue formation, or simply time, that healing process stalled out. The tissue remains in a state of chronic inflammation without progressing to its true repair. It's like having a construction crew that started a job but never finished it. The controlled microtrauma from shockwave therapy essentially hits the reset button on this stalled healing process. It's like telling your body's repair mechanisms, hey, there's still work to be done here. And when those acoustic waves hit your damaged tissue, several remarkable things happen almost immediately. First, blood flow to the area increases dramatically. More blood flow means more oxygen, more nutrients, and more of your body's natural healing factors reaching in the damaged tissue. This is crucial because many chronic foot and ankle problems involve tissues with naturally poor blood supply. Second, the treatment stimulates the formation of new blood vessels, a process called angiogenesis. This improved vascular supply helps ensure that the healing tissue will have the ongoing blood supply it needs to stay healthy. Third, shockwave therapy stimulates the production of collagen, which is the main structural protein in the tendons, ligaments, and other connective tissues. Think of collagen as the scaffolding that gives the tissues their strength and flexibility. Fourth, it helps break up scar tissue and calcium deposits that might be interfering with normal tissue function. In chronic conditions, scar tissue often builds up over time, and this scar tissue is weaker and less flexible than normal tissue. And finally, shockwave therapy triggers the release of growth factors and activates stem cells in the area. These are your body's natural repair crews, and getting them activated, working in the right place, is crucial for healing. What makes shockwave therapy particularly effective is that it's ideal for chronic, stubborn injuries, exactly the kind of conditions where your body has essentially given up trying to heal. Let me tell you about the conditions that respond best to shockwave therapy, because if you're dealing with any of these, this treatment could be life-changing for you. Plantar fasciitis is probably the condition I treat most often with shockwave therapy. If you've been dealing with that stabbing heel pain, especially first thing in the morning, and other treatments haven't provided lasting relief, shockwave therapy has an excellent track record. The plantar fascia is that thick band of tissue that runs along the bottom of your foot from your heel to your toes. When it becomes damaged and inflamed, it can cause excruciating pain. The problem is that plantar fascia has relatively poor blood supply, which is why plantar fasciitis can be such a chronic, stubborn condition. Shockwave therapy is perfect for this because it dramatically increases the blood flow to the area and stimulates the formation of new blood vessels. I've seen patients who've suffered with plantar fasciitis for years get complete relief after just a few shockwave treatments. Achilles tendinosis is another condition that responds exceptionally well. Notice I said tendinosis and not tendinitis. Tendinitis implies acute inflammation, but what we usually see as chronic Achilles problems is tendinosis, actual degeneration of the tendon tissue. The Achilles tendon has areas of particularly poor blood supply, especially in the zone about 2 to 6 centimeters above where it attaches to your heel bone. This is why Achilles injuries can be so slow to heal and why they often become chronic. Shockwave therapy can stimulate healing even in these poorly vascularized areas by increasing blood flow and triggering the formation of the new blood vessels. We also see excellent results with other forms of heel pain, whether related to heel spurs, fat pad problems, or other causes of chronic heel discomfort. The beauty of shockwave therapy is it addresses the underlying tissue damage regardless of the specific diagnosis. Tendon and ligament problems throughout the foot and ankle also respond well, whether it's peroneal tendinitis along the outside of your ankle, posterior tibial tendinitis problems on the inside of your ankle, or ligament injuries from old ankle sprains that never fully healed. Shockwave therapy can restart the healing process. Now let me walk you through exactly what happens when you come in for shockwave therapy, because I think you'll be surprised by how comfortable and straightforward the process is. The entire treatment takes about 10 to 15 minutes. You'll be comfortably positioned on the treatment table, and I'll apply a water-based ultrasound gel to the area we're treating. This gel helps the acoustic waves penetrate effectively into your tissue. Then I'll use the shockwave device to deliver the pressure waves to the precise area of your pain. You'll feel a rhythmic tapping or pulsing sensation. Most patients describe it as a feeling like someone is tapping them with a finger or like a gentle woodpecker. The intensity of the treatment can be adjusted based on your comfort level and the specific condition we're treating. We want you to feel the treatment. That tapping sensation tells us the waves are reaching the right depth, but it should never be unbearable. Most patients relate any discomfort at about a 4 to 5 on a scale of 1 to 10. What's remarkable is that no anesthesia is needed. Unlike injections or surgical procedures, shockwave therapy is well tolerated by virtually all patients without numbing medication. In my practice, I use a specific 3-stage treatment protocol that I found to be the most effective. In the first stage, I focus the shockwave energy directly on the focal point of your pain. This is where we deliver the most concentrated energy to restart the healing process in the most damaged tissue. I don't move the device around much during this stage because I want the energy focused on that specific area. In this second stage, I treat the tissue surrounding the primary area of pain. For example, if we're treating plantar fasciitis in your heel, I'll also treat your arch area. If we're treating Achilles tendinitis, I'll also treat the calf muscle. This helps address the broader biomechanical issues that may have contributed to your injury. The third stage uses a different device called the V-actor. This provides vibration therapy to help relax the muscles and improve circulation. This helps restore normal muscle tone after the shockwave treatments and allows metabolic waste products to be cleared from the area. After the treatment, there is essentially no downtime. You can walk out of the office and return to your normal activities immediately. Some patients experience mild soreness for a day or two after treatment, similar to what you might feel after a good workout, but this is actually a positive sign that the treatment is stimulating the desired healing response. We typically perform shockwave therapy once a week for 3 weeks. This spacing allows your body time to respond to each treatment while building on the progress from the previous sessions. Some patients notice improvement after just the first treatment. They might tell me that their morning heel pain is less severe or they can walk further without discomfort. Others see gradual improvement over the course of the 3 sessions. But here's what's really exciting. Healing continues for weeks and even months after your last treatment. This is because we're not just providing temporary symptom relief, we're actually restarting your body's natural healing processes. And those processes continue work longer after the treatment is finished. Most patients begin to experience significant improvement within 2 to 4 weeks after starting treatment, with continued improvement over the following months. The full benefit might not be apparent until 3 to 6 months after treatment, but the results tend to be lasting because we're actually healing the damaged tissue. I believe in being completely transparent about costs, so let me address the financial aspect of shockwave therapy. Currently, insurance plans, including Medicare, do not cover shockwave therapy. This is because it's considered regenerative medicine, and insurance companies are often slow to cover innovative treatments, even when they have excellent safety profiles and proven effectiveness. I know this can be frustrating, especially when you're dealing with chronic pain that's affecting the quality of your life. But I want you to think about this as an investment in your long-term health and quality of life. How much have you already spent on treatments that provided only temporary relief? Physical therapy copays, multiple doctor visits, prescription medications, cortisone injections. These costs add up quickly, and they often don't provide lasting solutions. More importantly, what's the cost of continuing to live with chronic pain? Missing work, avoiding the activities you love, the impact on your relationships and mental health. These hidden costs of chronic pain often are much higher than the cost of the effective treatment. When you consider that shockwave therapy results can last for years, and they may be able to avoid more expensive treatments like surgery, it often makes financial sense as well as medical sense. Let me share what patients actually experience with shockwave therapy, because the results speak for themselves. The most common thing I hear from patients is how surprised they are by the improvement in their pain levels. Many come to me after months or years of chronic pain, and they've almost forgotten what it feels like to be pain-free. But it's not just about pain reduction. Patients consistently report better mobility and function. They can walk longer distances without discomfort. They can return to exercise and activities they've given up. They sleep better because they're not waking up with pain. One of my patients, a marathon runner with chronic Achilles problems, told me that shockwave therapy didn't just eliminate his pain, it made his Achilles tendon stronger than it had been in years. He went on to run his personal best marathon time 6 months after treatment. Another patient, a nurse who'd been dealing with plantar fasciitis for 3 years, said that after shockwave therapy, she could work a 12-hour shift on her feet without the constant heel pain that had been making her job miserable. What I love about these results is that they represent long-term healing, not just temporary symptom relief. We're not just masking the pain with medication or providing short-term relief with cortisone injections, we're actually healing the damaged tissue. Clinical studies support what I see in my practice every day. Research shows that shockwave therapy provides significant pain relief in 70 to 80% of patients with plantar fasciitis, and similar success rates for other chronic tendon problems. More importantly, these improvements are maintained long term. Let me explain why shockwave therapy can succeed where other treatments have failed, because understanding this can help you see why this might be the solution you've been looking for. When tissue is chronically injured, several things that happen that interfere with healing. Blood flow to the area decreases over time. Scar tissue forms, which is weaker and less flexible than normal tissue. The cellular machinery responsible for producing new healthy tissue becomes less active. Most conventional treatments don't address these underlying problems. Anti-inflammatory medication can reduce pain temporarily, but they don't increase blood flow or stimulate tissue regeneration. Cortisone injections suppress inflammation, but they don't help damaged tissue heal. They can actually interfere with the healing process. Physical therapy is excellent for addressing biomechanical issues, but if the underlying tissue damage isn't healing, PT alone may not be sufficient. Shockwave therapy addresses all of these problems simultaneously. The acoustic waves cause immediate vasodilation. The blood vessels open up, dramatically increasing the blood flow to the area. This brings oxygen and nutrients while helping to clear away metabolic products. The mechanical stimulation also activates cellular pathways that promote healing and tissue regeneration. At the molecular level, shockwave therapy increases the production of growth factors and activates stem cells in the treated areas. Perhaps most importantly, shockwave therapy helps remodel scar tissue. Instead of weak, disorganized scar tissue, the body produces new, properly organized collagen that restores the strength and flexibility of the original tissue. As we wrap up our exploration of shockwave therapy, I want you to remember that gentle tapping sensation I described in the beginning. It's hard to believe that something so comfortable can be so powerful, but that's exactly what makes shockwave therapy remarkable. This gentle pulse truly can heal like a hammer, breaking through the barriers that have prevented your body from healing and give you back the active, pain-free life you deserve. Shockwave therapy represents a powerful option that doesn't require surgery, doesn't involve medication, and has an excellent safety profile. It's particularly valuable for patients who've tried other treatments without success because it works through completely different mechanisms than conventional therapies. Please take a moment to like this video. Hit the subscribe button so you don't miss the rest of the series. Share this video with anyone who's been told they have to live with chronic foot or ankle pain. And don't forget to get your free comprehensive audio course on regenerative medicine at www.regmedcourse.com. This course goes even deeper into the treatments and includes information that could help you make the best decisions about your foot health. Thanks so much for watching, and have a great day.